Welcome to All The Abili-Tea with Nikki.
Hey!
The show that informs, uplifts, and celebrates people of all abilities.
Because everyone deserves a story, y'all.
The show that asks the question, what does Long Island have to offer people with special needs and disabilities?
That part.
And here's your host, Nikki Johnson.
Girl! Hello, everyone. Welcome back to All The Abili-Tea with Nikki, where we spill the tea on all abilities and everything in between. I'm your host, and today we are chatting with Nina, a nurse at a group home, to give us some perspective on what life is in a group home and what parents should really know medically. The episode is for every parent who has ever laid in bed thinking, who is giving my child their medication correctly? What happens if something goes wrong? And are they actually taking their meds? Because today we are talking about the medical side of group homes. We're talking about the real, everyday, behind-the-scenes care that parents need to understand before placing their medically frail loved ones in a home. And I could not have a better guest for this conversation. We have Nina here today, who works directly in a group home, caring for adults with disabilities, and she is about to give us the tea. Welcome, Nina. How are you?
I'm good, thank you. Thank you for inviting me.
Oh, no, thank you for being here. So let's get started. What comes to mind when I say to you, what is the most creative way you've seen someone avoid taking medications? What?
Not now. You know, usually it's not now. Can you come back later? I'm not ready. You know, but you try to walk the person through explaining the necessary reason why the doctor has ordered the medication for them to take it. But again, They also have the right to refuse their medication.
Oh, wow. So they have the right to refuse.
Yes.
So what happens then? Has there ever been a serious case where,
Again, it's talking to the person and explaining why the doctor has ordered this medication. Why don't you want to take it? Maybe it's not, the fluids aren't in their favorite cup, or maybe it's they want a certain person, certain staff to give them the medication. Yes.
And you work through that with them.
Yes, we do.
Oh, wow.
Yes, we do.
I didn't even think of that.
Yes.
Have you ever had a resident negotiate meds with you?
Yes, as far as maybe the resident is on several medications. Maybe they want them separated by color, by size.
Wow.
Maybe they're not taking it also because you're giving them water and they prefer apple juice. So it all depends. And it's getting to know your persons.
That's a lot. A lot goes into this, I see.
Yes.
And I didn't even... This is the first couple of questions, and I'm like mind boggled right now. So, all right, let's get into this. So this is what parents worry about most, the medications. How are they actually handled day by day in a group home?
Well, the residents are... we work off the doctor's orders.
Right.
Whatever the doctor prescribes, that's what we will give to the residents. And we're working with a pharmacy that delivers the medications, and we go,
from there.
Off the doctor's orders, yes.
Who's responsible for giving the meds? Is it the nurse only, or is there staff trained? Like, how does that work?
Staff are trained in dispensing medication. They sit for, there's a course that they have to take that's approved through the state of New York.
Oh, my God. I think it's coming back to me because I used to be a direct care professional in the early stages of my career.
Yes.
AMAP.
Yes.
Oh, my God. That was horrifying.
Yes. And then they have to, they take tests. If they pass, then they have to be, they would have to meet with a registered nurse from that agency, and to make sure that they comprehend everything. They show the nurse that they have successfully, 3 times they have to pour medications in front of a registered nurse to show that they are qualified, capable of dispensing medication.
Oh, okay. Well,
Yes.
I'm sure that makes some parents feel better.
Yes.
Okay.
Yes.
Yeah, because
Yes.
that sounds like a lot of
Training and education that the staff is given.
terrific. Okay, so let's talk about what parents need to provide. Do they send in medications? Like, do they have to come in with medical on their person? Like, what?
No. What happens is when the resident lives, they could live, even if they live in a facility away from a group home, meaning, let's say that we can talk about group home, we could talk about the hospital. All medications must have a doctor's orders. And then the physician would e-scribe it to the pharmacies that whatever agency facility is using, that medication is brought in by the pharmacy, given to the house, the facility, and then we would dispense the medication as written by the doctor.
Well, how do you keep the medication stored? Like, is it locked? Like, how do you
Yes.
organize it all? Because I'm sure you have more than one resident in the home. Like, I'm sure that gets crazy.
Right. All medications should be locked at all times, away from anybody and everybody.
Okay.
Your narcotics would be stored if the resident is on what we call a controlled substance, it's double locked in a metal storage container, and the regular medication would always be locked in a med room.
Wow.
It's all
right.
stored in a med room.
So what systems are in place? Say something goes missing. Has that ever happened?
Missing. Medication does not go missing. No.
It doesn't fall on the floor? Like, what if it falls on the floor or something?
Well, then there's a proper protocol that the staff would have to follow that drop the medication. But again, they're taught how to dispense medication so there would not be medication errors or medications falling on the floor.
Oh, all right. And how do you track the medications that are given? Is there like documentation, charts? What?
Yes. Some facilities still use paper Mars. Some might be on what's called electronic medication charting that the staff would sign off on.
And that's been effective?
Yes.
Okay. All right. Very interesting.
Yes.
What happens if a resident refuses to take their meds?
They have all rights to refuse. You would ask, the main question to ask the individual, the person, is why? Why don't you want to take the medication? Is the medication hurting your stomach? Maybe they're not ready to take it. Maybe they need 5, 10, 15 minutes. Maybe, again, the fluids, they don't want to take it with fluids. Maybe they want to take it with applesauce or chocolate pudding or vanilla pudding or Jell-O. It could be something as...
But what's the protocol if they just flat out, and you've tried all of those things, and they flat out said, I'm not taking this?
We would, they don't want to take it now, we'll come back and reapproach them, maybe 10, 15 minutes, give them a break. But if after you've tried 3 or 4 times and they don't want it, they have the right to refuse.
Wow. Okay.
And then we would notify, there's a chain of command that you would notify that, the resident does not want to take the medicine.
Okay. And what should parents double check about medication safety before choosing a place to place their child?
Again, the medication is all written by the doctor. So hopefully the doctor has already educated them on the reasons as to why they're taking this medication. But the families can always ask, I know, the person is taking this medication. Could you remind me as to why they're taking it? We can always show them the med room, the setup of how.
Okay. All right. Oh, so you're very open.
We're very open.
Okay.
Yes.
So now let's talk about doctor visits.
Yes.
Who schedules the appointments? Is it the parent? Is it the group home? Who coordinates the specialists? Like all of that. Like that just seems like a big job.
Well, usually what'll happen is if the parents want to continue with their providers that they've been using, that's fine as long as the doctor is okay. Sometimes parents still take their loved ones on the doctor's appointments.
Oh, okay.
But if the parents no longer want they want the facility to take the loved ones, we will continue to provide that.
Oh, all right. And who takes who like when do the staff do it then?
The staff can do it.
They can do it, and
staff.
sometimes it could be like a lot of people in one van. I remember that.
Well, we try to do, well, it would only be the family would meet us at the appointment if they want to go.
Oh, okay.
If they don't want to go, then it would just be the individual and the staff person. And then we have, a summary sheet we call.
Mm-hmm.
And the staff would also know about the resident. And then we also ask the resident to be their biggest advocate themselves, as long as they are, are capable of
Right.
speaking for themselves.
Okay.
Yes.
Do the parents get updates
Yes.
every time?
If the parents want to go to the visit, they're more than welcome. If the parents have concerns, they can always call and speak to the nurse or the doctor.
That's a lot. I do remember it, though. I remember sometimes being in a car with like 5 people going to, well, I remember the nurses made it very convenient because everyone would be scheduled maybe at the same doctor's office sometimes, or maybe the same area, so it wouldn't get so
We're
jumbled.
We're trying to do center one-on-one appointments, meaning that if an individual needs to go to the appointment, it's only about them and
Right.
not in a group setting.
Right.
It's all personalized care we're giving.
Great. Okay. All right. So let's get to the question that every parent is, I think, almost afraid to ask. Emergencies. What kind of emergencies have you actually seen happen in a group home setting?
It could be, it all depends on the makeup of the house, but anytime that there's an emergency, we always call 911 first.
Okay.
911 is called immediately for anything that we feel that could be detrimental.
And the staff, because is
Are
it
all
24-hour
trained.
nursing or is it
It's 24-hour.
staffing?
Every facility is different. Nursing homes always have 24-hour nursing and staffing.
Okay.
Okay. Every facility is different, but there's always staff on every shift, days, evenings, and nights.
So when you call 911, when do you call the parent?
After after 911 has come and taken the consumer individual towards the hospital, then we will call. But then it's also depending. Has the family stated, hey, I don't want to be notified until the resident has already been seen at the ER? So it all depends.
Wow. Okay. Oh, so all of those questions are asked prior to anything that could possibly happen.
Correct.
That's a lot. Okay.
Correct.
Now, is staff trained for emergencies like seizures or choking,
Yes.
or they're
Yes.
trained for that also?
Yes.
Okay. Is that part of the original training? They have to,
Correct.
same thing, they have to pass certain tests and,
Correct. And then we continue to educate.
oh, okay.
And then, again, we try to do a lot of personal, knowing the individuals that you work with their different diagnoses. All the staff should be aware. So this way they're giving the best care that they can to each person.
Wow. Okay. Now, if I'm a parent preparing to place my child in a group home, what do I need to send medically? Like, is there a list, my prescriptions, like all of that?
Yes.
Medical history?
Yes, we would need, we would like to have an annual physical. So this way we have all the different diagnoses and a list of all the providers. We would also need whatever health insurance cards that they have, their last exams. And if the family is like, you know what, the provider can't see because maybe they've aged out, then we would suggest, hey, these are the providers that we use. Would you like to use them? And we would go from there.
What if a parent forgets something important? What happens?
No, parents are usually very open to us and letting us know everything, sharing, because we would now be taking care of their loved one.
Okay. What's one medical question parents never ask but you think that they should be asking?
I think all parents do a wonderful job, and they will have that open relationship with nursing and the house managers to let us know. Even if they forget, they can always contact us.
Okay. What would you say to a parent who's scared to trust the group home medically? Like, has ever been a situation where they tried to just not even, like, to do everything and the child's in the group home?
We encourage the families to always come and visit so they can see the facility, the group homes, the different areas of the home, learn the individual's day-to-day that would be going on, and they're always welcome to come.
Well, that's terrific.
Stop by for visits.
Well, I do remember when I used to work in one of the group homes, it was an open door policy.
Yes.
Yes. And they tried to make everyone feel as comfortable as possible. It did encourage the parents to come. Mm-hmm. It makes it for a better, more seamless transition, and also just...
And the parents I think they also get a feel of when they're walking in and seeing, and we try to make, again, the different facilities tries to make it, again, person-centered. We celebrate the holidays, any holidays, the residents, we do decorate, for Christmas, New Year's, having parties, birthdays, again, it's all person-centered.
To make them the most comfortable in their surroundings, in their living environment.
This will be the individual's home for...
Yeah, the foreseeable future.
Right.
That's amazing. So, as a nurse, what do you think was your best, most proud moment being a nurse?
Having a resident, honestly, saying my name.
Oh.
Saying my name. Glad to see you. Thank you. Just a big smile.
Because of the care you've taken of them, and they felt...
That I've given, and that they feel comfortable enough to trust me enough to have a relationship.
That's beautiful. That is beautiful. What else do I want to ask you? Because this is a hard topic and a hot topic, because when you're planning to put your child, I'm sure, out of your residence and putting it in other people's care, medically frail, that is the most fearful as a parent as you can get. It's good to know that you guys do try to make it an actual home.
Yes.
And not a facility.
Correct.
You know what I mean? Like, that's what I have noticed, the trend from years ago. It's actually home living.
Correct.
And I'm sure that makes parents out there feel much better, specifically from someone who's actually working in these homes every day.
I try to, when I used to teach, I used to suggest to staff, to new hire, that you always want to treat someone as though you would want your grandmother or your grandfather to be treated.
Exactly.
It's a fine line that we all walk, that today you could be the caregiver, tomorrow you could be receiving the care.
Wow. Okay.
So you always want to keep that. Again, my biggest like I stated, when I used to teach was, again, this is how I would want my grandmother, my grandfather to be treated. And remember, it's a fine line. Today you're giving the care, tomorrow you could be receiving care.
And what would you say to that parent that is very scared to trust the group home medically?
The parents have to, I also think that actions speak louder than words. Mm-hmm. Feel free to come by, stop in, come have dinner, have breakfast.
Right. See what's actually going on.
Correct.
Okay.
Come and see. The door is always open. And we always state what we're going to do. We always have the open communication. They can always call the nurse. They can always call the manager to see what's going on the day-to-day. And the individual will always be able to tell. And then I think that when the family comes, they will see the happiness, the smiling.
Right.
That, that they're receiving the best care that we can give.
That's beautiful. Now, thank you so much, Nina, for being here and answering these questions so honestly, because this isn't just information. This is like peace of mind for many families. And I know there's parents out there that feel much better with the decision making that they've made or that they may have to make in the future from some of the things that you've said. And for every parent that's listening today, it's not about finding the perfect place. It's about finding a place that's prepared, structured, and truly does care for your child, where medications are handled with precision and emergencies are handled with urgency, and your loved one is treated with dignity every single day. And, it seems like that seems to be what people are trying to do.
And a lot of parents have what's called like a get to know packet to get to know the resident. Like if the individual has a certain nickname, they might go by, just to tell us. Or I also do private duty. So if I walk into a resident's home, individual's home, it tells me, like their favorite color is blue, their favorite, drink might be orange juice, whatever.
Yeah, it's definitely important.
Their niches are, that I get to know because I want to know more about the resident, the individual.
And that's what makes it more personalized care.
Correct.
That's terrific. Okay. All right. So, Nina, I really want to thank you for coming today and answering all these questions. I know I put you in the hot seat, but I feel like these are things that parents really must know, especially in this field. So we appreciate the work you do, honestly, and thank you for giving us all the real tea about group homes. How can listeners find you?
631-428-1705.
Wonderful. And what are you able to do for them, or what service are you also providing?
I am a Medicaid provider nurse, so the families can reach out to me.
Terrific.
All
right, terrific.
If they need private duty nursing. Yes.
That sounds great. Thank you so much. And everyone, I'll see you in the next episode.